The history of American medicine is a remarkable journey from rudimentary, often ineffective practices to the advanced, technology-driven healthcare system we see today. This transformation has been influenced by scientific breakthroughs, policy changes, medical education reforms, and the evolution of healthcare institutions. In this script, we will explore the major phases of this transformation, the key figures and movements that shaped it, and the challenges that still persist in the medical landscape. 1. Medicine in colonial America and the early 19th century. In the colonial era and early 19th century, American medicine was largely unregulated. Physicians were often self-taught, and medical treatments were rudimentary. Herbal remedies, bloodletting, and crude surgeries were common, often causing more harm than good. Lack of formal medical education. There were few medical schools, and most doctors learned through apprenticeships rather than structured education. Prevalence of folk medicine. Many communities relied on midwives, herbalists, and Native American healing traditions. No standardization of medical practices. Medical knowledge varied widely, and there was no unified system to regulate the profession. However, as scientific discoveries advanced in Europe, American physicians sought to modernize their practices by adopting emerging medical theories and techniques. The rise of medical institutions and standardization, mid-19th to early 20th century. During the mid-19th century, medicine in America began to take on a more structured and professionalized form. This period saw the establishment of medical schools, hospitals, and organizations dedicated to improving medical knowledge. The founding of the American Medical Association, AMA, in 1847. The AMA was instrumental in setting medical education standards and promoting ethical medical practices. Development of medical schools. Institutions like Johns Hopkins University introduced rigorous medical training based on European models, including laboratory research and clinical rotations. Advances in medical science, germ theory, pioneered by Louis Pasteur and Robert Koch, revolutionized the understanding of disease and led to improved sanitation, sterilization, and the development of vaccines. The growth of hospitals. Hospitals transitioned from being places for the poor to institutions that provided cutting-edge medical care, leading to greater public trust in formal medicine. These changes laid the foundation for modern medical professionalism and improved patient care standards. Third, the impact of technological and scientific advances. 20th century. The 20th century saw an explosion of medical discoveries that transformed healthcare. Antibiotics and vaccines. The discovery of penicillin by Alexander Fleming in 1928 and the widespread use of vaccines dramatically reduced mortality rates from infectious diseases. Surgical innovations. Anesthesia and antiseptic techniques made complex surgeries safer and more effective. Medical imaging. The development of X-rays, MRIs, and CT scans revolutionized diagnostics, allowing doctors to detect diseases with greater accuracy. Specialization and research. Physicians began to specialize in fields such as cardiology, oncology, and neurology, leading to deeper expertise and advancements in treatment. These developments improved patient outcomes, extended life expectancy, and established medicine as a highly respected and evidence-based profession. The evolution of healthcare systems and policies. Beyond scientific advancements, healthcare policies and economic factors played a significant role in shaping American medicine. The introduction of health insurance. The rise of employer-sponsored health insurance during World War II led to the modern healthcare financing system. Medicare and Medicaid, 1965. These landmark programs provided healthcare access to the elderly and low-income individuals, significantly impacting public health. The rise of managed care. The 1980s and 1990s saw the emergence of HMOs, health maintenance organizations, which sought to control costs but also faced criticism for limiting patient choice. The Affordable Care Act, 2010. This legislation aimed to expand healthcare coverage and reduce disparities in access to medical services. Despite these reforms, issues like rising healthcare costs, insurance complexities, and disparities in access to care remain major challenges. The role of technology in modern medicine. In the 21st century, technology has become a driving force in the evolution of medicine. Electronic health records, EHRs, digital record keeping has improved efficiency, coordination, and patient safety. Telemedicine. The rise of virtual consultations has expanded access to healthcare, especially in rural areas. Artificial intelligence and robotics. AI is assisting in diagnostics, robotic surgery, and personalized medicine. Genetic engineering and precision medicine. Advances in genomics are allowing for targeted therapies based on an individual's genetic makeup. While these innovations offer immense benefits, they also raise ethical and privacy concerns that require careful regulation and oversight. Sixth, challenges and the future of American medicine. Despite remarkable progress, American medicine faces ongoing challenges that need urgent attention. Healthcare inequality. Socioeconomic and racial disparities in healthcare access and outcomes persist. Cost and affordability. The U.S. has one of the most expensive healthcare systems in the world, creating barriers for many citizens. Physician burnout. Increasing administrative burdens and workload stress are leading to burnout among medical professionals. Global health threats. Emerging diseases, antibiotic resistance, and climate change pose new public health risks. Addressing these issues will require a combination of policy reforms, technological innovations, and a commitment to equitable healthcare access. The transformation of American medicine has been a continuous process of scientific, institutional, and policy-driven advancements. From the unstructured medical practices of the colonial era to today's cutting-edge treatments, the field has evolved dramatically. However, as new challenges emerge, the medical community must continue to adapt, ensuring that high-quality healthcare is accessible, ethical, and sustainable for future generations.